Alright, so the plan for today is we're going to go through the exercises that you would typically do post a total knee replacement or a partial knee replacement. In hospital, you would have been given some exercises to do. We're going to go through those today, so that you can, and the idea is that you can do them with us. If I'm going to do all the repetitions that we would have done in hospital, and if at any point you feel that you're getting behind, just press pause and then catch up with us. What you need for today in order to do the exercises is generally you need a towel, and I'm going to use a groovy gripper, although you can also use a towel when I use the groovy gripper. Alright, and you're also going to need a pillow. Alright, so let's get on with it. Just for today, my operated knee is the one that I've got the ortho grip on. Typically in hospital, you should be wearing a stocking over on your operated leg, which is mostly going to help with your swelling that you would have post-op. So the first exercise we're going to do is one of the things that we find that is difficult post a knee replacement is to get your knee fully straight. So if I push my knee down into the bed, I want the heel to lift up. That is often difficult. So in order to make sure that we get that end of range extension, we're going to do an exercise called torture pillow. And here it flies in my torture pillow. So we're going to put the idea is that you've got support underneath your heel and the lower part of your leg, and support underneath your thigh, but there's no support underneath the knee, and you allow the knee to just hang. And you're going to do this for 10 to 15 minutes. That is often quite difficult to maintain in just immediately post-op. If you can only do a couple of minutes, then that's fine. Start with a couple of minutes. I find it's also quite a good time for you to ice the knee, so you can put your ice pack on the knee and just chill while you're here. If it is getting sore in maintaining this position, you can also just do a light knee bend like that. That'll ease the knee off a little bit. Alright, I'm not going to sit here for 10 to 15 minutes while you do this. If you want to do it now, just push pause, otherwise we're going to carry on with the rest of the exercises. So having done torture pillow, it should now be easier to do end of range extension or straightening of the knee. So what I'm going to do, I'm going to push my knee down into the bed and I'm going to try and lift that heel. And I'm going to hold that for a count of 5. So we're going to do that for 5, 4, 3, 2, 1, good, and relax. And then you're going to repeat that exercise 6 times. So we're going to do the second one, and relax. If you're struggling to do it and you can't get the heel to lift, that is okay. What you want to make sure is that you're getting your quadriceps or your thigh muscle to contract. And we've got 3 more to go. Good to me, hey? Good. And 1 more to go. Once you've mastered that one, what you can then do is you can progress it to doing a straight leg raise. That would be lifting the leg straight up. So what you're going to do is you're going to lock your knee out. So try to get that heel up off the end of the bed. And you're going to bring your toes up towards your face, alright? And you're going to lift your leg straight up for me, like that, alright? Often that's difficult, so what you can do to help you is you can bend your other knee and you can push down into the bed. You can also grab your hands around that knee and then try and lift up, okay? Alternatively, you can also dig your elbows in to the back of the bed and lift up. So again, we're going to do 6 of those. We've done 3 already. So again, lifting it down. Make sure you bring your toes up. Don't have your toes pointing trying to do the exercise. It's much harder. So it's easier if I bring my toes up, push my knee down, lift it up. Good. And back down. And you want to just try and briefly hold it. Alright. The next one that we're going to do is we're going to just get a little towel. So that one uses a little bit of the hip flexor and the quads. What we want to now do is just make sure we're using quads. So we're going to get a little towel. Okay, and we're going to pop that underneath your knee. So just take a towel and roll it up. Okay, alright, so I'm going to put that underneath my knee, and same thing again. So I'm going to just push my knee down, and I'm going to lift up the heel. Again, I want to make sure I'm bringing my toes up towards my face. Alright. Yeah, this one's often quite a sore one because the cut is normally just about here. So just go straight through there, and it does feel a little bit uncomfortable. Again, if you need to, you can bend your other leg to help and use your arm if needed. So you're going to push down and lift it up like that. Good. And we have 2 more to go. If you're struggling with the exercises, so these are difficult, what I find it's better to try and do them little and often through the day. So you just do a few, about 6, a couple of times a day. You can do them up to 5 or 6 times a day. If you're getting better at them, then you can just stick to trying to do them 3 times a day. Right, pop that out the way now. Okay, the next one that we're going to do is we're going to get that knee bending. So I find it's just nice just to get a little bend of the knee. So just to sort of bend it up, go as far as you go. Remember, by the time that you have your first follow up with the surgeon, which is normally about 2 to 3 weeks post-op, what we are wanting is a nice 90 degrees. So about that angle of the knee. But we don't need to get that all on the first time that we bend the knee. So we're just going to kind of coax it up a little bit, and each time you want to find that you get a little bit more. And just keep the heel down on the ground. And you just gently bend in the knee. If you want, you can give it a little bit of assistance here. Hold it. If it feels stiff, just ease it off a little bit, and then bend it up again. Alright. And back down. The next one, we're going to do a stretch, and then we're going to come back to bending it again. So now I'm going to use my groovy gripper, or you can use a towel. Okay, you want to grab the solid bit over the foot, okay, and you're going to grab the handles on this, and you're going to, just like we did in torture pillow, you want to kind of push that knee down, and you want to try to pull your toes up towards your face. Okay. Patients often ask if we can use a TheraBand. I don't want you to use a TheraBand because often I find in the arms get a workout. I want the foot and the calf to stretch. And you're going to hold this for 30 seconds. We've done about 10 to 15, so we've got 15 more to go. So we're just going to hold that there. So if you've been struggling with torture pillow and trying to get that heel off the bed, nice time for the heel to lift up here. Alright. Nice easy stretch of the calf. Alright, so that's about 30 seconds. And we're going to relax. Alright, if you hit pause, you're going to repeat that 2 more times. So in total you've done 3 by 30 second holds. Okay, we're going to move to the next one. So what I'm going to do now is I'm going to bend the knee again, this time with a little bit more resistance. Okay, so I'm going to use my groovy gripper to bend back like that. When I'm doing this one, I want you to keep it nice and easy. Again, just bending it, each time getting a little bit further. Watch what you do with the shoulders. So you don't want to be pulling up here, alright? Or, again, keeping your elbows out and putting forward there, okay? So just nice and easy, you're bending the knee and you're assisting with the towel or with the groovy gripper. And last one, made for me. Okay, and it should start to feel a little bit easier. You can, if you want, you can also hold it for a little bit at the top. So hold it there a little bit for about 6 seconds. Good. And then you would straighten it, take the tension off, and then you easier to bend it again. Alright. So that normally completes what I term the bed exercises. Normally in hospital, we would have done those, and we would have then progressed just to do one exercise in sitting. So what we're going to do now is you're going to sit up over the edge of the bed, and you're going to need your towel again. And so I'm going to grab my towel, I'm going to fold it up, and I just want to get a little bit of support underneath my knee. Just makes it a little bit easier over here. Also that, it makes the exercise a bit easier. So initially, what you can do for this one, we're just going to straighten the knee. I'm going to put my good leg underneath my operated leg, and I'm just going to straighten it up as much as I can. And then I'm going to allow this knee to bend and control the bend on this one. And then at the end, when I get here, I can give it a little bit of a tug, just to bend it that little bit further. Alright, and again, we're going to push it up, good, and back down again. Generally in the first 2 weeks, when you go home, what we want is you to mostly have the leg elevated, so to get that swelling down. Try not to sit for more than 20 to 30 minutes with the knee hanging down. And also when you're sitting, what we want you to do is generally sit with your knee off tension. So we never would sit with our leg fully bent in this position. We would generally sit with it slightly supported on the floor or whatever. Alright, so nice easy exercise. If this one becomes easy, then what you're going to do, progress to the next sitting exercise, and from there you can straighten it up like that. Alright, a little bit of a tougher exercise, probably find it difficult in the first week going home, but towards the end of the second week you should be getting a hang of this exercise. Good. 3 more to do with it. So we're kind of just doing 6 of everything. And one last one. Alright. And that completes the exercises. So tune in later, watch the video, and do it another 2 more times today. So this is it from Physio Central. As we say, we are central to you, central to your well-being and recovery.